This was a private limited company with a mission to develop technology to assist care. They focused on delivering state commissioned care in volume over a wide geographic area. The care visits were scheduled consecutively in 15-minute units and organised in runs. Care workers were allocated runs as close to home as possible to reduce travelling time and expenses. They were not paid overtime if a call ran over, and some reported high work intensification with few breaks. They had a relatively high staff turnover as a company overall, but had managed to keep staffing levels stable in some areas. In these areas, recruitment was less of a problem, and they were able to organise the work rotas over a 2-week period in a way which allowed for regular working patterns and good rest breaks. So, for example, on week 1, they worked Monday, Tuesday, Saturday, Sunday, and week 2, Wednesday, Thursday, Friday. The care workers liked that they knew when they were working well in advance, with consecutive rest days and alternate weekends off. This made it easier to manage other aspects of their life, such as personal health appointments or childcare, and helped to make the job more sustainable. In these areas, they also tried to keep full-time staff working the day shifts of breakfast, lunch and tea, with part-time staff covering the evening bed runs. This helped care workers to maintain intense work schedules and be able to get enough sleep between shifts. In these areas, staff turnover was low and sickness absence had reduced. But in other areas that were struggling to recruit and were short-staffed, care workers reported call cramming and staff turnover was high. Employment contracts were on a 0-hour basis, although care workers said that there were always plenty of hours available. Pay was at the level of the real living wage. The company offered statutory minimum holiday entitlement, but no sick pay. We found instances of severe hardship suffered by care workers and their families due to serious long-term illness necessitating long absences from work. The care workers involved said that this was not enough to make them want to leave their job, but that they had only managed financially through the help of family and friends. The company did not pay for travel time or expenses, but had an arrangement with an accountant to assist care workers to claim work-related expenses directly from HMRC for a small fee. However, many care workers either didn't know about this service or hadn't got round to claiming, as they thought it was too administratively burdensome. Other benefits included a subsidised private healthcare plan and emergency use of a company car, for example, if they had a breakdown. The care delivery was centred around the care plans, which were task-focused and provided by care commissioners. Work autonomy was low in that care workers were limited to a narrow range of tasks on the care plan. However, we found many instances of rule breaking, where care workers did more than was expected of them to provide the care that they thought was necessary. For example, care workers were not allowed to run errands for clients, such as collect bread or milk, unless a shopping call was part of their package. The company explained that this was to protect workers from accusations of theft. So, to avoid any involvement with money, some care workers would occasionally collect shopping at their own expense. Some care workers said that it was this rule breaking and going over and above what was expected that made you a good carer.